The attorney's happy? Thanks again for listening to this Miller Media Group station.
Welcome to the WTIM Morning Show. I'm Avery Cooper. Your stream brought to you by People's Bank and Trust. They put people first. And Landmark of Taylorville. You always do better with Landmark. I'm here in studio with TMH Memorial Behavioral Health. Well, we have Director of Community Health for TMH, Darren Butts, and Regional Director of Behavioral Health, Amber Olsen, on the phone. Great to have you both here in studio.
Thank you for having us, Avery.
Great to have you here on the phone, Amber.
Thank you.
Yeah.
Good to be here.
So, this is Mental Health Awareness Month, if I have that right.
Correct.
Is that what it's called?
Correct. May is Mental Health Month.
And so we're here to talk about all the things that Memorial Health and Memorial Behavioral Health, which is a subset group. How would you describe it?
You're exactly correct. It's a entity within Memorial Health that is really located in all of our communities, that is really focused on mental health services. I think a good place to start is really to kind of talking about why our focus is on mental health and kind of how it all started.
Right.
Every 3 years, every non-for-profit organization has to do a community health needs assessment. Specifically here in Christian County, our community health needs assessment, we've established our community health needs assessment plan, and it is really we have priorities that we're focused on, that we're going to designate resources, time, and energy on, and one of those priorities is mental health.
And so, community health needs assessment, as you mentioned, came around every 3 to 5 years. With mental health, is there more that community health needs assessment found, or is it kind of more of a broad, okay, this is a subset, and then maybe some other
Right. We identified 3 priorities. Mental
okay.
health, obesity, and lung health are the 3 priorities that we're focusing on here in Christian County over the next 3 years.
Okay. So I feel like with mental health a lot of the time, and I mean that community needs assessment obviously shows that there's a need for mental health,
correct,
education, and also resources and all the things associated with that. But I feel like a lot of the time that the reason maybe there is a need is because there's a stigma to prevent people from getting help. What do you think about that, Amber?
Oh yeah, the stigma is really alive and well. I think that the federal focus, and even the focus from the media and individuals who are famous in our society, like athletes and actors, and they're all bringing attention to the normalcy of struggling with a behavioral health or mental health issue, but there is still significant stigma.
And so what with Memorial Behavioral Health too, you guys have done quite a few different things over even the last 6 months, including the behavioral health line. Remind me what the exact name of that is, Darren?
Sure, it's emotional support line.
Thank you. Yes. And that's been pretty successful, if I understand.
Yeah, there's a lot of services that we're kind of trying to bump up. It's all in response to our community health needs assessment, that being our priority. Like, we're looking at ways to increase services in our emergency departments in all of our counties. We're also looking at increasing the Memorial Behavioral Health presence in all of the communities we serve, and working with different schools, different organizations within the communities to evaluate programs and implement new programs to kind of focus on mental health services.
You mentioned schools too. Is that a pretty big part of the community health needs assessment that you guys found?
Very much so. Working in collaboration with me particular and with the Taylorville Public School District, they've been wonderful at kind of evaluating what they have. I mean, they've bumped up the services, and they're really good about kind of asking us for help, or we're working together to kind of really promote increase in services in our schools.
Amber, how does mental health and that stigma kind of play into children these days? I mean, feels like that kind of falls on the back burner. Mental health of children, a lot of times we're thinking about ourselves and how we can keep ourselves mentally healthy, but how can we make sure that they're also mentally healthy too?
I think it's really important for parents or loved ones to begin talking to children at a young age about the importance of mental health, right? We really want to stress for kiddos to eat their vegetables and, eat well-balanced meals so that they can grow up into healthy adults. But not paying attention to mental health can also have negative physical health outcomes later in life. So normalizing within the home self-care when it comes to our brain, right? Because our brain is an organ just like our lungs or our skin, and making sure that we put focus on the importance of self-care when it comes to mental and behavioral health.
And it sounds like that's more so to establish healthy mental health habits now as younger children than later, if I have that right, Amber.
Correct. Yeah, starting as soon as possible.
What's the importance of that?
Well, teaching healthy kind of emotional responses, right? It makes sense that we all get sad, mad, and nervous. Those are all really normal responses to various situations that children have just like adults do. But when they're little, they don't have the cognitive ability or the behavioral abilities to cope effectively or to put language around those experiences. So making sure that we give children emotional language to be able to name what they're thinking and feeling, and when they're able to identify how they're feeling, then that helps the parent and the child be able to problem solve, whether, teaching deep breathing, teaching the ability to take, a personal time out, like I need to step away from this situation, just all of those little things that can really help out in adulthood.
Darren, what kind of resources are available in the area for parents to take their kids and learn these kind of emotional,
right? Specifically
emotional
speaking,
skills?
here in Christian County,
Yeah.
We like to promote the emotional support line. That is kind of for individuals facing non-crisis issues like anxiety and depression. So it's a free service. The number to call is 217-588-5509. The hours are Monday through Friday, 8 a.m. to 8 p.m. And it's just a non-crisis call. So if you don't know where to turn, if you have questions, to kind of help you get into the services that you need. We also like to promote the National Suicide Prevention Lifeline. That's for immediate crisis, like if somebody is having suicidal thoughts, suicidal tendencies. The Lifeline is a 24/7 that is available to anyone experiencing those mental health issues. That number is 800-273-TALK or 8255. And we also here in Taylorville have Memorial Behavioral Health Clinics. So that's where we have services where people can meet with psychiatrists or any type of any of their behavioral health needs. That's located here in Taylorville as well. We can get a hold of our Memorial Behavioral Health Clinics, 217-525-1064.
I want to know kind of what the wait time is like to get into a psychiatry or therapy or stuff like that. I feel like a lot of the time that's another deterrent for a lot of people. They think, oh man, it's going to take too long, and then they just kind of keep putting it off. So I mean, is there any good news on that front?
I feel like the perception is that there aren't even services here in Taylorville. So that's kind of what we like to get out and promote, is that there are services available, and we're always looking and continually to increase those services based on the need. I don't know specifically on wait times or anything. I don't know if Amber has any insight on that or not.
Yeah, I do. We have, in response to the mental health epidemic that we're in, Memorial Behavioral Health has increased its staffing by about 40% in the last 18 months. We've worked really hard to make sure that we can meet the need. I would say that right now it might be a 2-week wait to get into a therapy appointment, which is actually really good considering that we are in a mental health crisis. But just like Darren pointed out, we have that Memorial Emotional Support Line. It runs 8 a.m. to 8 p.m. Monday through Friday, but we can serve all ages on that line. So if individuals are waiting for those 2 weeks, they can call that line for quick support that's absolutely free. But then we've also started providing bridge calls where individuals who are waiting for services get a phone call from Memorial Behavioral Health to check in, see how they're doing, see if there's any kind of coping skills that we can provide in the meantime before they get into that first therapy appointment.
Let me reintroduce you both. We have to take a quick break, and then we'll continue our conversation. I'm here with Taylorville Memorial Hospital and Memorial Health, Memorial Behavioral Health, to be exact. As you just heard from Regional Director of Behavioral Health, Amber Olsen. She's on the phone, and in studio, we have Director of Community Health for TMH, Darren Butts. I'm Avery Cooper, your stream brought to you by Landmark of Taylorville. You always do better with Landmark, and People's Bank and Trust. They put people first.
I'm Police Chief Andrew Pistorius with the Sullivan Police Department, here to talk about a topic no one wants to discuss, depression that many times leads to suicide. When a person is going through such feelings, many times family and friends don't know how to help, but there is help. If you feel depressed or lonely, there are many resources to help you. Call a trusted relative, friend, or minister, or call the Suicide Prevention Lifeline toll-free at 800-273-TALK. That's 800-273-TALK. All of us are here to help.
Here's what's on sale right now at Dick Van Dyke Appliance World.
Thanks, Chris. We have Frigidaire dishwashers with a stainless steel interior and also a stainless steel exterior. And it's, $150 off.
Incredible savings. And I see it has the nice towel bar handle.
It does. Now over here, we have freezers on sale. You get your choice of either chest or upright.
Selection is always nice. All right, Paul, let's go to the phone lines now. Caller, are you there?
Hey, this is Dennis Regan, chairman of Dick Van Dyke Appliance World.
Well, this music is loud.
We have top mount refrigerators in stock, washing machines starting at $529, ranges and microwaves in stainless steel, plus free financing available. Wow!
Dick Van Dyke Appliance World. When you buy from us, you get the whole store.
Take News Talk WTIM programming with you wherever you go, both live and archived. News Talk WTIM streams 24/7 simply by clicking the Listen Live icon at TaylorvilleDailyNews.com. And to hear archived WTIM programming like the morning or noon farm shows, expanded local newscast, morning show interviews, Swap Shop AM or PM, click the audio on demand icon in the upper left-hand corner. Whether it's your smartphone, tablet, or desktop, News Talk WTIM stream is with you wherever you go 24 hours a day at TaylorvilleDailyNews.com.
Welcome back to the WTIM Morning Show. I'm Avery Cooper, Landmark of Taylorville, proud to bring you this stream on TaylorvilleDailyNews.com's Facebook and WTIM TV YouTube. You always do better with Landmark. Along with People's Bank and Trust, they put people first. I'm here in studio with Memorial Health, including Memorial Behavioral Health, Director of Community Health for TMH, Darren Butts, and Regional Director of Behavioral Health, Amber Olsen. And Darren, you told me a little bit about the community health assessment that Taylorville Memorial Health and Behavioral Health has found as a whole. So I want to dive into that a little bit. Obviously, mental health, one of the three areas where Memorial Health has identified the community needs help with. But in that, what were those numbers like? What did they say that stuck out to you as a regional or director of community health?
Sure. I think what a lot of people in this area don't realize is that Memorial Behavioral Health is the single largest mental health provider in Central Illinois. So we have a presence in all the communities that we serve. And in this past year, since we've been maneuvering through the pandemic, Memorial Behavioral Health has seen a 23% increase in the individuals seeking therapy and a 50% increase in people seeking crisis services. So those numbers are pretty staggering, and that kind of really reemphasizes the need for our focus to be on mental health.
In a situation where mental health is declining for somebody, what kind of situation constitutes an ER visit? And maybe, what's the kind of situation that maybe needs some other type of service like outpatient services?
Right. I feel like the focus needs to be on, what institutes an emergency room visit more than anything. Is like
Right.
that's the big trigger.
Mhm.
And some of those triggers are if the patient has any visual, auditory hallucinations or delusions that threaten safety, severe side effects from medication, aggression or assault, severe insomnia for more than 2 days, confusion or mania that threatens safety, or an overdose, which is a physical health emergency. Those are things that the alarm should go off, and it should be an emergency department trip.
And well, what about things that are, maybe not quite as severe as that?
Yeah, I think those things are specific to feeling down, having depression and anxiety, and really not knowing where to seek those services.
Amber, something that you are very keyed in on is mental health of children. And I wanted to give you a chance to kind of go over some of the signs and symptoms to look out for as a parent or any other concerned adult for mental health of children. What are some of those signs and symptoms?
Sure. For the littles and the adolescents, you might be looking at increased irritability, struggles with focus, poor sleep, so wanting to sleep too much or not being able to get enough sleep, changes in eating habits, eating too much, not eating enough, kind of those uncontrolled worries, frequent mood changes, children wanting to isolate more than normal. So like really significant changes in behavior or mood.
And again, that's not necessarily, I'm just trying to reiterate part of what you said there. If a child likes to kind of be on their own a little bit, and that's just how they like to be, that's not what we're talking about here. We're talking about significant changes.
Correct. We're all different, unique, right?
Mm-hmm.
But when you see your child have a significant change in their behavior over a period of time, it might be time to, call for some help.
What kind of help is appropriate for something like that?
You can always call that Memorial Emotional Support Line and talk about what you're seeing with a graduate level clinician. We have graduate level clinicians manning that line, and they can help you kind of problem solve where to go, what would be the appropriate treatment. I think also making sure that the school that your child attends is aware of that the child might be struggling, so that they can keep an eye out too. But then always therapy, just going in, talking to someone, getting an assessment completed to get a clear picture of what might be going on with a behavioral health professional.
We're wrapping up this interview here in a moment, but I wanted to give you guys each a moment to kind of highlight Mental Health Awareness Month. I'll start with Darren. What would you think? What's the main message you want the community to know about mental health in this community?
I think the main message that we need to send out is that it's really okay to not be okay. I think is the focus is as we sit around and we have conversations just like we're having right now. This is informative and hopefully informative to the public and people that can say, yeah, I'm dealing with this, and it's really okay that I can seek service. It's not a weakness. It's not that you're not tough. It's that you need help. Lots of people need help, and the more services we have and the more we talk about it, the better things are going to be.
Amber, what do you want the community to know about mental health?
I really want to stress what Darren shared. It's okay to not be okay right now, and really at any time. And if you're struggling, reach out for some help. The sooner that you reach out for help, the sooner you can feel better and the less negative outcomes you'll have down the road.
That is Regional Director of Behavioral Health, Amber Olsen. She's here along with Director of Community Health for Taylorville Memorial Hospital, Darren Butts. Thank you guys so much for coming in to talk about Mental Health Awareness Month.
Thanks for having us.
Thank you.
Landmark of Taylorville, proud to bring you this stream on TaylorvilleDailyNews.com's Facebook and WTIM TV YouTube, along with People's Bank and Trust.
The Big 870 WTIM Assumption Taylorville, 96.1 W241 CF Taylorville, 107.5 W298 CD Shelbyville, 107.9 W300 EH Payne and Nokomis.
I'm Rich Thomason. Fierce fighting is raging as Russian troops storm the massive industrial complex in Mariupol. It's the last stronghold